things. We're here today to pay special attention to International Overdose Awareness Day, which is every August 31st. And today we want to just talk a little bit about our partnerships, things that we are doing in our community each and every day, but to make sure that you're aware that on August 31st, there are going to be some events and activities that you'll hear more about in just a little bit. But we want you all to be involved and play your part in saving lives and supporting those who have lost loved ones to overdose during this time. So again, August 31st is International Overdose Awareness Day. To hear a little bit more about that and to hear from all of our partners, I'm going to step away and turn it over to our Mayor, Cavalier Johnson.
Great, thank you. All right, thank you, and good morning, everybody. First, before I begin my comments, I want to recognize the fact that there were a number of speakers here. You'll hear from many of them. I do want to highlight that Alderman Charlene Moore from the 10th District has joined us, as well as Alderman Peter Bergelis from the 11th District. So thank you both for being here with us. Since the start of this year, there have been nearly 140 fatal overdoses across our county, with most occurring on the south side of the city of Milwaukee. It's a stark reminder of the urgent work that all of us need to do. We've got to destigmatize substance abuse and use and recognize that the folks who are affected by this, they're not strangers. These are people that we know. They're our family, they're our friends, they're our coworkers. The issue touches all of us, and our response must be both compassionate as well as understanding. The purpose of International Overdose Awareness Day is to bring this issue front and center, keeping it in the public's awareness, in the public conversation, and ensuring that it gets the attention that it really, really deserves in this community, in this state, and across this country, and even internationally. As mayor, I've got a unique perspective on the many layers of support needed to tackle the opioid crisis right here in our community. Because it's about more than immediate interventions. It's about long-term recovery. It's about sustained support. It's about addressing the root causes of substance abuse. So my office, the Milwaukee Health Department, they're working upstream to address the crisis through strategic investments and proactive measures. And we're committed. We're committed to creating environments where everyone has the opportunity to lead healthier lives. Our fire department is out there each and every single day, and you'll hear more about that from Chief Lipsky when he has the opportunity to speak here in just a moment. But they're out there each and every single day responding to overdoses as well as providing life-saving interventions. They're a critical component and a part to our community's health and our response. In 2023, fentanyl played a role in 70 to 80% of overdoses in Milwaukee County each month. This dangerous substance continues to be a major factor in overdose deaths, and we need to focus on reducing the impact of fentanyl here in our community. The number of non-fatal overdoses in the city of Milwaukee, unfortunately, has doubled from around 2,100 in 2019 to around 4,300 in 2023. This alarming increase highlights the need for more robust prevention as well as intervention strategies. And we've got, as I said, so many partners who are working day in and day out to address this situation right here in our community. And I do have a proclamation just highlighting the fact that there are so many organizations that are out here working so diligently on the issue. I'm not going to read every single line of it, but I'll read a couple of whereas clauses. Whereas International Overdose Awareness Day is an opportunity for people to remember loved ones in an environment free from shame and stigma. It provides an opportunity for people to connect with others who share similar experiences and come together to fight and reverse this devastating trend. And whereas the City of Milwaukee applauds all Milwaukee organizations, advocates, and community members' efforts to increase awareness of these fatal overdoses and works towards reversing these trends on August 31st, 2024, and all year long. And now, therefore, I, Cavalier Johnson, Mayor of the City of Milwaukee, do hereby proclaim, this will be for Saturday, August 31st, 2024, to be International Overdose Awareness Day throughout the entire City of Milwaukee. I'm going to present that now to Rise Drug Free MKE. Thank you. And with that, as mentioned, I mean, there's so many outstanding partners each and every single day who are working on this issue. Chief among them for us is Milwaukee County. At this time, I'm going to introduce Milwaukee County Executive David Crowley, who's working to make this the healthiest county in the state of Wisconsin each and every single day. Ladies and gentlemen, please give a round of applause for County Executive David Crowley.
Well, good morning, and thank you, Mayor Johnson, for that introduction. I want to say thank you to all of the healthcare providers, the dedicated harm reduction experts, and the passionate community members who are joining us on today. And for this year's theme for International Overdose Awareness Day, it is Together We Can. And as I look around and see everybody who is joining us today, I know that together is the only way that we can end overdose and save lives. We have incredible community organizations like the Mayor pointed out, organizations like Samad's House who are joining us today, who are bringing healing services throughout our entire community. We have the City of Milwaukee initiatives like the Maury program and the Health Department, new naloxone boxes, making sure that supplies are easily accessible and emergency response is not only quick, but it's safe and effective. And right here within Milwaukee County, we now have 19 harm reduction vending machines placed in community centers, healthcare clinics, and other public locations all throughout Milwaukee County. And these vending machines are providing easy access to free harm reduction tools such as nasal naloxone, fentanyl and xylazine combination test packs, drug deactivation pouches, lock bags, and gun locks. And our Better Ways to Cope campaign is here to promote harm reduction services, re-grants funds to community organizations, and share resources with the community members all throughout Milwaukee County. But it not only takes these programs and initiatives, it takes all of us. It takes all of us really stepping up to the plate to make a positive change throughout our community. And so focusing on improving access to harm reduction and behavioral health services is important not only to my administration, but it's important to me personally. It's important to this entire community because this is a personal issue for many Milwaukeeans. Substance use and overdose can affect anyone, regardless of your age, regardless of your race, gender, socioeconomic status, or where you live throughout Milwaukee County. But the first thing that we need to do is end the stigma of getting help. And so today and every day, we need to make sure that we're having open and honest conversations about substance use rather than trying to hide it as something that is shameful. And that's why International Overdose Awareness Day is so critical. And so I'm asking you all to show some support. We need your support, particularly for those who continue to face the challenges of addiction. And we need to show that we can destigmatize the resources and the tools that community members need to help fight another day. It's extremely important that people understand that we need to destigmatize this issue. And so I am committed, and I think that everyone in this commitment should use this day to renew our commitment to supporting one another. That's what we should be doing as community members. And I truly believe in the world of addiction that not every role is for everyone, but every person in our community has a role to play to help end overdoses. And so I want to encourage everyone in this room and those who are watching all across this community to find your role, to figure out how you can volunteer, how you can donate, and how you can help spread not just the awareness, but to help us end the stigma of getting help, ending the stigma of kicking the addiction. Because together, we can and we will end the overdose crisis right here in our community. And so I just want to say again, I'm extremely proud of the many community organizations, the community partners that have been at this table, and want to be able to bring another community partner that we have been working hand in hand with throughout my administration, including the mayor's office, and that is our Common Council President, Jose Perez.
Morning. Thank you, Mayor. Thank you, County Executive. I appreciate your call to action. I'd like to thank everyone here who's in the fight. And the theme, Together We Can. So I believe that very strongly. And I want to thank everyone who made today possible. I would ask everyone here to understand that I criticize no one who stands up against the tide of these drugs that have taken so many from us. telling story of those damaged by opioids trying to rebuild their lives and communities wounded by them. It's heartbreaking, and I'm here to help honor those. There's an irony, however, in having an Overdose Awareness Day. Awareness? Come to the 12th Aldermanic District, stand on a few street corners, see streets where young people should be playing with families and should not walk the littered streets with discarded needles. See our brothers and sisters lying in the streets like the living dead. See men and women and children selling themselves. The 12th District is alive with hope. We have lots of new entertainment venues, new housing, new businesses, and new schools are sprouting up everywhere. The newspapers write about it, and the television cameras occasionally come to have a look. The same district, though, my home, which encompasses both 53204 and 15, has the largest number of opioid overdoses year to date in the city. This is nothing of which the neighborhoods affected by this crisis needed to be made aware of. They have called out for us for years to stop the trade of these substances in hope that all the horrible secondary effects would be stopped as well. We have not done enough, but together we can. If there is anything of which I would like this community to be aware of, is that I know the people here that we must do more, and together we can. We must do more to stop the smuggling and the trade. This is not a victimless crime. We can't pretend that policing has no role and that prosecution is not needed. We must intervene to provide better choices for those who have used or might be using drugs. Careful study of these things that drive people to this level of self-harm is needed, and we cannot stop here. We must proactively work to eliminate those causes and do whatever we can to heal those who have abandoned hope. Together we can. And we must remain ready to assist those who do make these choices. I am grateful to the Milwaukee Fire Department, Community Medical Services, all the players involved for a forward-thinking approach to overdose victims. It has saved lives, and I trust will continue to do so, to do more that can be done to make these efforts unnecessary. I and those whom with I serve to be a part of the solution, we will do whatever is within our power to address this issue. In the meantime, however, we will never diminish the urgency or the severity of the problem, which we are all too well aware of. My constituents call every day. We're making referrals, we're handling. I want the community to know. I want those who are in need of any type of AODA treatment that we are listening, we're helping, we're hoping that we can work together to address this. So with that, I want to thank all of you for being here, and I'd like to introduce Fire Chief Lipsky.
Good morning. I'm Fire Chief Aaron Lipsky, Milwaukee Fire Department. I'm here wearing two hats today. I'm also the chair of RISE Drug-Free MKE. It's a very, very broad coalition of public, private, health sector, law enforcement, treatment, counseling, and this stretches across the entire expanse that is Milwaukee County. Together we can, and together we are. And as I approach this podium, you know, I'm inclined to just say I wish I could talk about anything else right now. I wish we could talk about something else. I wish we could do something else other than this. It is wearying, it is depressing, it is exhausting. But it is nowhere near as exhausting as those that are gripped by the addictions and the mental health that underlies and undergirds every one of those addictions, and the socioeconomic factors that push people into these corners from which addiction is their only perceived relief. So we have got to continue talking about this. The mayor said a very important word before. He said the word stigma. We have got to get rid of the stigma associated with addiction. Many of our perceptions, many of our spoken words about what addiction is and what it looks like are founded upon watching NYPD Blue or Hill Street Blues. That is not what it is. It's everywhere, it's all of us, every one of us has been gripped by this in some fashion or another, either personally or by very close relationship. It is everywhere right now. So what do? We have to come together. There have been strides made in this city and this county directly as a result of some of the folks you see standing here willing to work together and not work in silos and not do this thing that causes so many things to just stall and nosedive. So we have an extremely aggressive county executive with his health services just going at this thing. We've got the city of Milwaukee, we've got a health commissioner here, second to none, and everybody is finally clicking. We're making this thing work. If you've paid attention in the past year and a half, we have had 4 separate treatment facilities, medically assisted treatment facilities open up in our city, obviously servicing also the rest of the county as well. This is groundbreaking, literally. And we need places for these folks to go. A huge part of that has been combating the stigma that the mayor spoke of. Because folks in neighborhoods are under the impression to bring a treatment facility into your neighborhood implies you're just going to have all of these addicts and all the stigma that goes with that. When in fact, the addicts, the people gripped with addiction are already in your neighborhoods. This is just giving you a solution. So I'm proud to stand before you, as bleak as the picture is that I might have just painted. I'm proud to stand with everybody here. We're firing on all cylinders here, and you know, we have started to see some gains. The numbers that were talked about where non-fatal overdoses are climbing and climbing. Fatal overdoses, we are starting to see it level off. We are starting to see a change. We don't want to celebrate this too early because anomalies happen all the time, but it does represent that the Narcan available in the vending machines, available from Milwaukee Fire Department in our Hope kits, available from every fire station, police department is participating in this. Narcan allows a person to stay alive, which allows a person the hope for treatment. Absolutely together we can, and we will continue doing this. I'm very, very proud to introduce one of our largest components in this entire thing, and that would be Milwaukee's Health Commissioner, Dr. Michael Todoritis.
Thank you. I'm Mike Todoritis. I'm the City of Milwaukee's Health Commissioner. As a public health department, we witness firsthand the devastating impacts of overdoses, not just in our community, but across the country. This isn't a distant issue. It's a problem right here in Milwaukee affecting our families, friends, and neighbors. Overdoses extend far beyond the individual. They affect entire communities. At MHD, we know a person's surroundings, from their living situation to their ability to access the resources that they need, affect and influence their future and likelihood of using substances. We rely heavily on the collaborative efforts of our first responders like Milwaukee Fire Department's Maury Initiative, as well as the community organizations such as Samad's House, RISE, and the county's Better Ways to Cope program. Each of these groups are on the front lines, providing immediate assistance and connecting people to long-term recovery resources. Our research and experience show that people who use substances will continue to do so regardless of the risks involved. Therefore, our best course of action is to reduce the likelihood of overdose and prevent deaths. Making naloxone and fentanyl test strips readily available, encouraging people to not use alone, and avoiding the mixing of drugs are all practical strategies that can significantly reduce the likelihood of overdose. We need recovery options that meet people where they are. Just like the fire department's Hope kits, the county's harm reduction vending machines, MHD is committed to making a difference by offering free Narcan and fentanyl test strips at all of our locations, no questions asked. But if I'm being honest, the health department has only scratched the surface with harm reduction. We recognize the urgent need for stable housing, better funded community programs, and comprehensive approaches that meet people where they are. Events like this press conference and International Overdose Awareness Day serve as powerful reminders of the MHD's ongoing mission to work tirelessly towards the overall health and well-being of all of our communities. Part of MHD's commitment under the Public Health 3.0 model is to collaborate with public and community health entities to make harm reduction supplies more accessible to the people that need them and ensure that health equity is at the forefront of those efforts. Today, as we acknowledge International Overdose Awareness Day, let's remember that each statistic represents a person, their story, and a life that matters. We must continue to push for better support systems, more accessible resources, and a community where everyone has the opportunity to thrive. Thank you again for being here and for your commitment to this critical issue. Together, we can make a difference. And with that, I'd like to introduce Tahir Malik, the founder of Samad's House.
Good morning, and thank you, Dr. Mike Todoritis. I'm honored to stand before you today. I thank the mayor for joining us. I thank the county executive for joining us. I thank Fire Chief Lipsky and Dr. Mice and Deshaun Ewing for standing before us today. As I stand before you again today for International Overdose Awareness Day, I always remember the why we do this, the why we go out weekly at targeted outreach to provide resources in much needed neighborhoods. The why is that we lose people. The why is that the non-fatal drug overdose deaths are still rising in our communities, our BIPOC communities. I have to always remember the why to continue to fuel my targeted outreach with community medical services, the Maury Project, Rise Drug Free Milwaukee, and I'm honored to be part of Better Ways to Cope through Milwaukee County. Through this initiative, we're able to provide information, dissemination, and harm reduction resources to those areas. Yes, last year we had a 1% decrease in fatal drug overdose deaths, but the numbers of non-fatal are still climbing, and until we can bring those numbers down, we will continue to run full throttle. My why is that we have to continue to save lives. And the only way we can do that is together we can. It is my honor. This year we took a different approach. Instead of doing it in all of the targeted neighborhoods, we decided a remembrance walk would be very impactful. Let's honor those lives in another way. We partnered with Healing Starts Today, Rosalind McLean. She is the CEO and founder of Healing Starts Today, which is a mental health and substance use clinic. With all of us together we can.
Good morning. Thank you all for coming. I want to thank all of these wonderful people for showing up this morning and just showing up for the community. This coming Saturday, August 31st, we are having a Rhythm and Soul walk run honoring the International Overdose Awareness Day. I would like to personally invite everyone to come out. By the blessings of our sponsors, our title sponsors I have to mention, which is Rise Milwaukee, MKE, Drug Free, thank you, and the Infinite Church. They have made a lot of this possible so that we're able to offer all of these things to the community for free. The event will start at 9:30. That is for registration. The actual walk run, the Remembrance Walk, will take off at 11 a.m. This event will last throughout the day, ending at 5 o'clock, so it is okay if people cannot make it at the beginning. At whatever point you're able to make it, you are able to participate. We will have a lot of different things going on that day. We will have healing spaces. We will have Narcan training. We will have yoga and sound baths and all sorts of activities for the children. So again, I really, really appreciate you guys. I hope that everyone is able to make it out. Oh, there will be free food. The location? Oh, sorry. We will be at Veterans Park, Milwaukee's beautiful lakefront. And, you know, as she just stated, my agency, we focus on mental health and substance abuse challenges. Just in the last couple of months, we personally within our agency has lost several people due to overdose. We know that right now the numbers for last year is over 660 people that we lost, but we also know that that is only what is on record. And I am 100% positive that it is many, 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 many more lives. So this walk, yes, it is a remembrance walk. It is a walk to remove the stigma. It is a walk for people to celebrate, you know, a victory lap also. And I just really want the community to participate. Thank you.
So once again, we just want to continue to uplift our community, our voices, the voices of those who have lost loved ones, those who are yet in the struggle, because we know together we can, and together we will. We are very optimistic in our work, even though day to day we see things that would make us not so, but we choose to be. In this work, we choose to continue to fight each and every day, and we thank you all for being here. Thank you, media, for covering this, because it is very important that we get the word and the message out. So we hope to see everyone on the 31st, which is this Saturday. We know it's Labor Day weekend, so we want you to come out and have a great time with us as we celebrate, as we honor, as we remember, and as we grieve if we need to. Because those spaces will be available at the Lakefront Veterans Park, 9 to 5. We also will have shuttles. If you are choosing to park somewhere or you don't want to deal with the challenges down at the lake, we have a shuttle running from Washington Park Senior Center, from that parking area, and then also Metro Park, where the parking is right behind the domes. So we have shuttles that will be running every 30 minutes throughout the day on the 31st from 10 o'clock till 5 o'clock. So there's no excuse. You should be there. Hang out with us. That is all we have at this time. Do I have any quick questions from anyone? Hearing none, thank you very much. Thank you all for being here. Thank you for all of the politicians, all of our community members, all of our first responders, all of our agencies. This concludes our press conference.
Where are you going to put that now?
I don't know what the final location for it.
Should we have it at the table during this for the week?
I think we should. I think we
You
could.
think it'll be safe?
We'll probably have to hide it somewhere each day.
Or leave it with the information center? Maybe they'll just thank you, sir.
Right,
Appreciate you.
You have to,
Oh, and it's even
you have to
took
spend
a lot.
time going through there. Yeah.
I had him take pictures for us. So that way when everybody was up there, I sent them all.
Okay. If anyone has questions, you can talk to Amanda. She's great.